And I look forward to this engagement. I hope we have all gone through our slide deck for today, and of course, we are prepared. My role will be basically to usher you in to speak. I will not pose any questions, so I will allow you to flow with the presentations as prepared, based on the guidance that the hosting team had provided. I will only be interested later in ensuring that we keep time, and then also making sure that we get to respond to comments and questions from our audience. With that, I think as we wait for the team to flag us off, we will just be staying online and allow ourselves to. So I won't also delve into your detailed profiles. I will allow you to speak for yourselves. I believe in giving voice to the person to speak for themselves. So I'll just introduce you, the name and the title, and then after that, I'll invite you to just speak about yourself and your profile. I hope that's okay with all of us.
Thank you, Helen. This is Jemima. I wanted to point out that I will join you for this webinar for the first hour, so I may not be able to stay for the Q&A. I do hope you allow me to do that. I've just come from mission about 3 hours ago at 4 a.m. and I do need to go offline to join another meeting on COP with the UAE government at 9, unfortunately. But I will be here for the first 1 hour.
Okay, I will take note of that, and I'll make sure that we also get, I think, if there are any questions or comments that will require your response, then we'll usher you in within that 1 hour. Karibu sana. Also, just to alert all of us and the team that is coordinating the session, I'm in Addis right now, and the weather is very unpredictable. It's been raining for a while, and just in the case that power just drops off, Sarah and the team, you'll have to step in very quickly to moderate if necessary. But so far, so good. I hope that doesn't happen at all during this period of time.
Thank you so much, Helen. That's well noted. And thank you, Jemima. The 1 hour is well noted. So we're starting to admit the participants so that we start immediately at the top of the hour.
Okay, just also checking that if we have our PowerPoint presentations that you'd like to show, I think the team is on standby to either show the slides on your behalf, or if you want to show them yourself. The assumption is that the host allows you to be able to share the slides yourself. Okay, great. I can see it's 3 o'clock, and hoping that we have enough quorum to be able to start our session this afternoon. So allow me to welcome everyone to our webinar this afternoon. Good morning, good afternoon, good evening, depending on where you are. Welcome, karibuni sana. Our conversation today is guided by the theme, Pathways to Progress, Navigating the Intersection of Sexual Reproductive Health Rights and Women's Economic Power. Our hosts are the Women's Economic Empowerment Community of Practice and our community of practice that is also newly inaugurated, the one on sexual reproductive health rights and gender-based violence. So we are having very informative conversations around pathways to making progress. How do we navigate and make sure that we take care of the intersections of sexual reproductive health and women's economic empowerment and the issues that arise within that. The objectives of our conversation today will showcase evidence on the context, on the status and pathways through which economic opportunities will influence women's access to sexual reproductive health and rights outcomes. And we will also discuss the challenges and opportunities of attaining positive SRHR outcomes, as well as discussing policy and practical options that we would recommend for sexual, economic, and sexual reproductive health challenges. Before we go very far, allow me to acknowledge the team that is coordinating our work in this context, and this is Center for Women's Research, ICRW, and this afternoon, we are blessed to have a very powerful panel of experts that will be taking us through the conversation. It will be more of conversation and not a top-down approach, because we will also have a session where we'll be interacting and engaging with each other in breakout sessions. Before I go into our agenda for the day and how it will run, allow me to acknowledge all the 75 members of the different communities of practice that are coordinated by ICRW and the work that they are doing. And we acknowledge all your contributions, and especially mentioning and the intersectionalities of the issues that are addressed by the different working groups. Also, specifically to acknowledge the members of the Sexual Reproductive Health Rights and GBV thematic working group. And this community of practice is chaired by the SDG Kenya Forum and the Center for Rights Education and Awareness crew. And the rest of the members will be mentioned on the chat by our host teams. In the interest of time, I would like to also proceed to just set some ground rules in terms of how we are going to proceed in today's session, just to make sure that we all understand the ethics of attending this webinar and how we shall engage with due respect to each other's space. Particularly, we urge that we all remain muted unless we are making a presentation or we are making a contribution, in which case you will raise a hand and our hosts will be able to admit you at the appropriate time. Meanwhile, during the presentations, please feel free to introduce yourselves in the chat box right now. For all those who have joined, introduce yourselves in the chat box, and also continuously just let us know your names, your organization, maybe your title and contacts. And if you have any resources that you'd like to share, with the participants, please drop the links on the chat. Also, please do send questions via the Q&A chat box anytime during the session, and we'll be able to pick them up for responses from our presenters. And the presenters will also be able to see the questions and prepare adequately to make their responses. This meeting is being recorded, and therefore to just request for your permission and consent to do that in line with the Data Protection Act of different countries that may have joined. Also, to note that the webinar will have 2 breakout sessions that we'll be going into, and we'll have group leads that will be introducing at that time. Let's move to the next slide. Just to introduce our speakers. So our first speaker will be Dr. Jemima Njuki, who is the Chief of Economic Empowerment section at the UN Women. And we welcome you. We are glad that you've been able to join us. And we look forward to having the conversation with you, Dr. Jemima. She will be speaking to us and enabling us to understand these intersectionalities between SRHR and women empowerment. Our next speaker will be Ms. Catherine Nyambura, who is a global health and gender equality expert at ICRW, and she'll be speaking to us about policy and advocacy and drawing very critical linkages within how to do advocacy and the policy issues and gaps and recommendations for both SRHR and women economic empowerment. And then we have a male champion who is going to be speaking about the role of men and the masculinities. That's Dr. Chimaraoke Izubara, the Director for Global Health, Youth and Development at ICRW. So we have a competent panel that will be ready to engage. Feel free to engage them in both in the Q&A and in the chats as much as possible throughout the sessions, but also we'll have a plenary where we'll be speaking to the 3 of them in open session, where you'll be free to speak to them or still continue in your chats. And then after that, we'll do a breakout session. So in terms of time management, we now have 8 minutes past our time, and I would like to start the session officially by inviting our first speaker, that's Dr. Jemima Njuki, to take us through women economic empowerment and SRHR intersectionality. Karibu sana, Doctor. Over to you.
Thank you so much, Helen, for that introduction and for setting the scene. It's such a pleasure for me to join you today. As Helen mentioned, my name is Jemima Njuki. I lead the UN Women's Economic Empowerment work in New York, basically leading work on women's decent jobs and entrepreneurship, on gender responsive climate action, on financing for gender equality, as well as the work that we do supporting governments on macroeconomic policies. So such a pleasure to be talking on this topic. I'm just going to start with stating, something that may be obvious, but not always very obvious, that the connection between sexual health and reproductive rights and economic empowerment is actually a two-way interconnection. So sexual and reproductive health and rights are fundamental for women's economic empowerment, but we also know that economic empowerment is a facilitator for women's enjoyment of sexual and reproductive health and rights. And I'll just start with the first connection, the fact that sexual and reproductive health and rights are fundamental to women's economic empowerment. And this includes the right to decide if and how many children to have, the right to live free from disease and from violence, the right to access confidential health and high quality health services. And all these enable women to have the ability to control their bodies. But I also say that realizing these rights is necessary for women and girls to stay healthy and to participate in education and to fully participate in all facets of economic life. And so we really cannot divorce the exercise of power and control over resources from women's ability to exercise control over their bodies and live a life free from violence. And this is not a new connection. I think even from the early feminist economists like Naila Kabir, she actually says, if the aim of women's economic empowerment is not to simply create more female entrepreneurs, farmers, or wage workers, but to dismantle some of the barriers that perpetuate gender inequality in the economy and wider society. If that is the goal, then we should include greater attention to the non-economic dimensions of change when we have economic empowerment programs. And so what we see is that women's economic empowerment and exercise of economic power has graduated from being solely focused on economic concerns, concerns such as income generation, access and rights to land and labor, or product and financial markets, to recognizing the importance of really diverse women having power and control over resources to meaningfully participate in decision-making that benefits them, their families, and their communities, with a huge focus on women benefiting themselves, women using resources to make decisions about their lives. And so central to women's power and control is this ability to exercise control over their own bodies through the enjoyment of sexual health and reproductive health. But what we see very often, very, very often, and I can tell you from someone who's overseeing a large portfolio of economic empowerment programming, what we really see is sexual and reproductive health and rights are often missing from economic empowerment programming. They might feature in programs as risk mitigation strategies, but never as a comprehensive part of economic empowerment programming. And this is something that needs to change. A truly gender transformative approach that takes a holistic view to addressing violence and sexual health and reproductive rights issues as an integral part of the work we do in economic empowerment and women's economic power is really needed. And this is despite decades of research demonstrating that there are measurable benefits of investments in sexual rights and sexual and reproductive health and rights, but still seeing these discussed as separate to women's economic lives. So we have very strong documentation on the health benefits of investment in sexual and reproductive health. And until recently, the non-medical benefits, such as higher levels of socioeconomic participation, but these has mainly been ignored. And in a lot of cases, it's because a lot of those working in economic empowerment and women's economic power find some of these social changes much more difficult to measure. If you can imagine that for a long time, those who dealt with economic empowerment were mainly people coming from the economic backgrounds, and other than feminist economics, they found it, the methods for measuring these are the changes, social changes that arise from economic empowerment and women's economic power as difficult to measure. But we also see these other connection, the limited access to sexual and health. I'll just keep calling it SRHR for ease of going through this. How it impacts women's economic empowerment opportunities in both formal and the informal sectors. And I'll just mention a few of those. First, even just the basic issues that we know that we are seeing in many countries, including Kenya, the multiple and unwanted pregnancies including young teenagers, how that impacts maternal health, how it increases the time that women have to spend on unpaid care and domestic work. And what this does is it increases women's economic vulnerability and dependence on men, which then increases their vulnerability to sexually transmitted diseases by constraining their ability to even negotiate the conditions and terms of sexual encounters, ranging from whether to abstain from sex, condom use, multiple partnerships, and all these really shape the vulnerability of women. One of the evidence that has become increasingly clear as we have studied labor force participation and women's engagement in economic activity is that before we often used to talk about the gender gap in labor force participation, but we are also seeing is the female labor force participation of women between 25 and 39 years decreases with each additional child by about 10 to 15%. So there is also a motherhood penalty or a penalty when women become pregnant, and therefore their ability to choose when to have children, how to space their children is really important for their economic engagement. So we see the extent to which women's increased entry into the paid labor force may be empowering depending on the context, the reasons for women's economic participation, the existence of regulatory frameworks to support women's economic participation, the type and conditions of work, but we also see huge effects of that from their ability to make choices about childbearing. The other specific thing I would like to mention again, and I said this briefly, is the issue of unpaid care work, which is really linked directly to SRHR. Without access to SRHR services such as family planning, women cannot choose, as I mentioned, if, when, and how many children to have. And what this does, it increases the unpaid care work responsibilities. It exacerbates already existing inequalities in women's share of caregiving. It increases their time poverty. And when it increases their time poverty, this also has health and not just economic consequences for them, but it also has health consequences for them. So we see gender inequality in caregiving responsibilities impacting on women's ability both to enter the formal economy, but also to make choices about their economic participation in other spheres. What we are also seeing is that the economic power and the SRHR connection, they are also intermediary factors. And I know you will all agree with me that we have also seen economically empowered women who do not have control over their sexual health and reproductive health. And so there is also intervening variables in terms of their ability to make decisions on that income, their ability to make decisions on how they can spend that income, whether they can spend it on themselves, whether they can spend it on their health seeking, on seeking health, sexual and reproductive health services, issues around norms, and I think that there'll be some conversation later on that. So it is also not a direct relationship between SRHR and economic empowerment and economic power. So just to take note that while economic empowerment and economic power is a necessary condition for women to seek sexual health and reproductive services and to enjoy those rights, it is not always a sufficient condition. And we do have to do more in terms of increasing women's decision-making ability, as well as engaging men and boys around sexual and reproductive health. The other comment I want to make is around that the connection that we don't always make is the availability of health and social protection systems. And while we might say provision of health is more on the health side, we find social protection systems as an economic issue. And when social protection systems are weak, or they're weakened by conflict, they're weakened by disasters, they're weakened by pandemics, they are weakened by inadequate coverage, a lot of households then have to rely on home-based care, with women and adolescent girls carrying the overwhelming responsibility for this work. The other thing that I would like to mention is the intersectionality. I know you talked about intersectionality in terms of this intersection between SRHR and economic empowerment and economic power. But I want to talk about intersectionality in another broad sense, in terms of the different marginalizations that women face, and how that influences both their economic abilities, but also their access and exercise of sexual and reproductive health and their rights. And I want to talk about women, for example, those that are marginalized, those that are not always in the economic system, young girls, including teenagers, adolescent girls, trans women in the LGBTQI group, who also face specific constraints in terms of both access to sexual and reproductive health services, but also access to economic opportunities. And I want to finish by saying that, having said this, we know that there's a lot that's happening. And what I would say is that the lived experiences of millions of women is that their participation in all facets of the economy depends not only on access to education, but also enjoyment of their rights to a life free of all forms of gender-based violence, and enjoyment of full sexual reproductive rights, but also that we have to redistribute unpaid care work responsibilities. But such changes, as I mentioned, require addressing structural inequalities, including breaking down some of the harmful gender norms. And so as we build economic empowerment programming, we must include attention to these multiple and intersecting forms of inequality that limit different women's ability to enjoy their freedoms. I would like to say that this approach to women's economic empowerment is endorsed in the agreed conclusions of our 61st session of the United Nations Commission on the Status of Women, our CSW 61, as well as the United Nations Secretary General's high-level panel on women's economic empowerment. So both these have really affirmed the importance of SRHR as a contribution to the fulfillment of women's economic rights women's independence and empowerment. I'm going to stop there and be ready to engage over a couple of these issues. Back to you, Helen.
Thank you very much, Dr. Jemima, for that. I think that was really insightful for a starting point of this conversation. A few points to note that have come through is the fact that, the rights to health is interlinked and intertwined with all the other many rights that, for example, cultural rights, civic rights, economic rights, and the right to life, and most importantly, the right to choice, to make decisions. And Doctor, you have spoken very eloquently about the issue of power and how it's important to pay attention to the non-economic aspects, just to go beyond income and the rest of the indicators that are usually measured, to go to the software of the underlying, indicators of empowerment for women to be able to access all the sexual reproductive health and rights that are provided for. We also note that there is need, it's very, very critical to take a holistic approach in terms of the responses that are provided, especially in the economic sector, to also always remember and connect the fact that women, economic empowerment and power are very critical aspects to analyze and ensure that they are taken care of. In terms of the chain of service delivery in the health sector, what are the basic needs, issues of access, availability of the basic services, but also I think the quality of the services and whether the services are acceptable, do they meet the realistic needs of women in a particular community? And most importantly, the need for a very, very intersectional approach. And you mentioned the heavy burden of the unpaid care work and the fact that we need clear policies and programs that specifically address that, those human rights violations where states are currently actually taking advantage of the labor of women without recognition and without redistribution. So this needs to be changing. So we need a very critical political will from member states and from countries and all actors to ensure that power is given back to the women, but also they need to be liberated from the bottlenecks and the barriers that prevent them from adequately participating in all the other sectors that enable them to achieve and fulfill their rights as a whole. With that, I want to thank you so much, Doctor, for that. And I would like to invite our next speaker, who is none other than Ms. Catherine Nyambura, to take us through the policy and advocacy aspects of women, intersectionality of women, economic empowerment, and SRHR. Catherine, karibu sana. Over to you, Catherine.
Thank you so much. Thank you so much. I hope you can hear me, Helen. Please confirm.
Yes, we can hear you. We can also see you. Go ahead.
Thank you so much. Yes, I want to introduce myself again. My name is Catherine Nyambura. I go by Kate, Director of Programs at the Athena Network and a long-standing friend of ICNW, with whom I've worked on some policy advocacy achievements in the past, and excited to be joining you all. I wanted to build on some of the very brilliant and intersectional points raised by Dr. Jemima, and just to again emphasize the intersectionality of SRHR and economic power. I like the framing of power and not just empowerment. Women already have the power, and I think a lot of the times one of the critique that we have to be cautious to not make is that when we make these linkages, oftentimes it sometimes lead to an instrumentalist approach where we're trying to derive more resource and labor from women, as opposed to be working on a framework of agency and choice and voice for themselves. So a lot of my intervention will be leaning on that and starting to articulate on the fact that in instances and in many of our countries, we understand that we do have punitive and sometimes discriminatory laws, especially that target women's sexual reproductive health and rights. And when that happens, Socioeconomic ability means that there is a much more entrenched barriers of accessing services, which means that women, girls, and gender diverse persons from poor neighborhoods. I happen to have grown up in one of the informal settlements in Nairobi. It means they cannot be able to access the services they need, which limits their contribution to the economy. And so I do think that making that important linkage, that even when we don't make the linkages explicitly, some of the circumstances already make these linkages with or without in some of the design that's made through structural approaches to lawmaking and legal regimes that we operate under. And in instances where we have seen, for example, a move towards digitizing health services, what that means is that factors like gender digital divide, which are often very entrenched deeply in socioeconomic inabilities, means that women and girls, especially adolescent girls, young women, and others who don't have control over their access to technology, means they cannot access services. So we constantly see that women's economic power or lack thereof constantly harms them. Feminist activists and advocates have constantly made this linkage, and in the past, I think we do have lots of policy advocacy gains to stand on. I'll start with some of the homegrown ones, like the regional ones. So speaking about Maputo, we've seen Article 10, Article 14. Article 14 specifically speaks about a broad range of SRHR, sexual reproductive health and rights services for women. One of the most very comprehensive framework, including on rights like safe abortion and others, as granular as you can get in terms of SRHR services. We've also seen Maputo being one of the policy documents that makes explicit links between dispossession of certain groups of women, like women living with HIV and widows who get dispossessed of their proper productive resources like land because of social norms like wife inheritance, etc. We've also seen Maputo Protocol, for example, Article 10, clearly illustrating that there is need for us to deprioritize military spending so that we can have more investments and resources for social services and public services that often benefit women and girls and are important for our discourse on gender equality. So I do think we do have some gains on the continent on this. On the 20th anniversary of Maputo Protocol, I think it's important for us to keep going back to some of the higher benchmarks that we do have, and we should continue building on. On the continent as well, the ICPD program of action is one of the global landmark policy on SRHR. The Addis Ababa Declaration on Population and Development, which was a result of the 20th review of the ICPD, it explicitly also makes the link to SRHR and economic empowerment. So I think we do have a lot of documents and policies and attempts to make this linkage explicit. It's just important for us to continue popularizing this and make sure that we localize, domesticate, and amplify this so that there is knowledge of what this looks like in terms of legalizing and litigating this at the national level and at sub-national levels. We've also seen processes like the GEF, where there was a track on economic justice and rights and bodily autonomy. And we did have a lot more prominence and traction on conventions like the ILO C190 that specifically talks about sexual harassment in the world of work. For the 12 GEF commitments from Kenya, the ratification of this was one of the commitments from Kenya. So it's important for national advocacy to continuously get us to the point where it's ratified. As of date, we have less than 10 African countries that have ratified: Namibia, South Africa, and a couple of others, including CR. So it really shows us that there is an expansive overview of what the link looks like in terms of SRHR and economic empowerment. Even when women have access to economic opportunities, the workplaces that they operate in sometimes are continuously perpetuating violence, harassment. And Dr. spoke about the motherhood penalty, but we also have others in the sense that beyond the motherhood penalty, we also have the very quote-unquote glass ceiling and solutions that often try to fix the women and not the systems. So I think it's important for us to constantly make sure that we think of what the workplace looks like. The ILO Convention C190 does expand that framework into what the world of work looks like, formal, informal economies, in terms of domestic work and what that looks like, and protections and safeguards for women and girls in those spaces and gender diverse persons, as we've come to understand. And in regimes and other discourses like the universal health coverage, whose aim and specific goal is to address financial hardship when accessing health services, including sexual reproductive health and rights. Components like abolishing user fees and ensuring that we are mindful to have universality and reaching the farthest first. In many instances, it means women, and women are not homogeneous. We have women in rural areas, we have indigenous women, we do have women with disabilities, and making sure that aspects like user fees are not limiting access to, are not limiting ability to enjoy health services, including SRHR. Very clear focus on what coverage looks like for health services. We do know that insurances don't often cover all sorts of sexual reproductive health services. And for this year, we will be having the second political declaration on UHC. And we do hope that there's a strong focus on sexual reproductive health services as well, because in terms of making sure that we do have not just the services, but also the ability to access the services. And Helen, on your commentary about accessibility, the WHO framework on affordability, acceptability, and accessibility and quality is very clear as to what this looks like. And for women, we know that sometimes affordability becomes one of the much more difficult bits, and accessibility sometimes because of mobility or some of the ways in which the economic power the economic arrangements are structured. And we've seen women sometimes move from formal to informal economy once they've gotten into reproductive ages because of some much more difficult maternal protection health policies that not being consistent or enforceable, or discrimination at the point of recruitment, etc. And so these are some of the points I wanted to raise today. And I'm happy to also talk about SDGs, which very clearly and explicitly entrenches this intersectionality within goal SDG 3 and SDG 5. SDG 5 that covers everything from SRHR 5.6 and paid care work and women's ability to contribute to the economy, and other aspects in terms of thinking of gender equality more broadly, but also very intersectionally. And at the midpoint of the SDGs, we hope that as we continue to implement and report on this, we push governments to expand their reports to show how intersectional their work, their approach to implementation looks like. And I think towards the end of my point of my intervention is to say that I think COVID-19 did make us see that the world of work can move right from our offices to homes. And what that meant is that it was much more visible what care looks like and what access or lack of access looks like, the GBV being a shadow pandemic, and GBV, SRHR, and what that means in terms of us thinking of services and health in a much more broader, intersectional and comprehensive overview. And so we have the opportunity now to continue entrenching this successes in policy. A couple of upcoming opportunities. In this month, we do have the midpoint review of the SDGs. Hopefully that gives us the momentum and impetus to continue pushing on some of the pieces that amplify this intersectionality. We at the last mile of this implementation of the SDGs, we know that from the report of the UNSG, some of where we are lagging the most behind are on the gender indicators of the SDG. So I do hope that there will be much more renewed focus and renewed attention to the SDG 3, SDG 5, and other gender indicators. We have the ICPD plus 30 process coming up, and I think it really gives us, as I said, we do have a very clear homegrown instrument, the Addis Ababa Declaration on Population and Development, and I do hope that as folks, all of us on the team engage, those of us who don't see ourselves as SRHR folks, maybe it's time to plug into that process and see how we can expand that intersection much more. Currently, there's only one paragraph on that intersection within the declaration, but it's time for us to be much more nuanced post-COVID-19 for us to expand that. So I think I'll pause there. I'm happy to take more questions later or provide more clarifications as needed. Over to you, Helen. Thank you.
Thank you, Catherine, for that very elaborate explanation and sharing of the different policy frameworks and opportunities that exist. I think you have clearly also emphasized and re-emphasized the fact that we need very clear policy frameworks that do not only look at provision of services, but most importantly, working towards ensuring urgency, mobilization of women, and giving them the choice, the power, and the options and alternatives to choose the services, but also to make decisions. And you're speaking very, very closely in relation to what Dr. had outlined earlier. I think that's a very critical conversation that we still need to take forward. What does empowerment look like? What does that power look like? And but also, I hope later our next speaker will speak more to the barriers that relate to the social cultural aspects and how to overcome that. You mentioned barriers of access to SRHR services. I think is beyond access. There are so many barriers, and hopefully they are going to come out very strongly in the conversation around male engagement and how that can be overcome. Comprehensive policy frameworks that you have outlined and narrated definitely do exist. I think one of the questions we would ask ourselves is why we still have gaps is in implementation. Is it because of lack of political will? Is it resources? We need to interrogate a little bit about why as a continent we have so many very good policies, very progressive, but the issue and the gaps are usually with implementation. Prioritization and resource allocation, of course, impact both the health sector as well as the economic empowerment sector, especially for women. And most importantly, looking at if you talk about SRHR, women economic empowerment, and the linkage it has with what happens in the job market, in the informal sector, and how the environment there either facilitates women to empowered or not. The issues of the wage gap come out very clearly, but also the work environment. Is it decent work? Is it enabling the women to actually balance their work and the family responsibilities? I think some of those takes us back to whether the environment, both at work, at the community, and in the individual level, enables women to thrive and not just to survive. The implementation of all these policies is critical, but it has to happen through
Elena, unmute. Please unmute. This is one.
Okay, so domestication also makes sure that the policies actually
Your voice was not clear.
Okay, sorry. It's my network, I think.
All right.
Yeah, I have network fluctuation this side. Sorry about that. But I think most importantly, she also outlined the opportunities that are outcoming. It's clear now?
Yeah, it's clear. You're audible completely.
Okay.
Please carry on.
Mute your mic then, thank you. And if you have any questions, please drop them in the chat and then we'll pick them up. So at this point, I would like to invite our next speaker, who is speaking on the role of men and masculinities, and that's Dr. Chimaroke, the Director for Global Health, Youth and Development at ICRW. Please take the mic, Doctor.
Thanks very much, Helen. And I also want to extend my thanks to the previous speakers. They just left me wondering whether this is whether there was a plan, to bring me behind two very eloquent speakers, and whether some of the points I'm going to raise now would actually make any sense. But having said that, my name is Chima Izubara. It's a long name, Chimaroke Izubara, but I think you can shorten it to Chima if that is much easier for you. And I work for the International Center for Research on Women as a Director for Global Health, Youth and Development. I have been asked by the organizers to briefly reflect on the theme of masculinity in relation to women's economic empowerment and the sexual and reproductive health. And I was wondering whether there is actually something new that I'm going to say, given the kind of audience that we have in this place. But having said that, I want to begin my reflection by just calling your attention to some of the concepts that I'll be throwing around I will start with that. Some concepts I'll be throwing around in my discussion, and then I will move on to some kinds of some existing evidence in literature in terms of how masculinity impinges on women's economic empowerment and sexual and reproductive health. After that, I will now move to look at this whole notion of positive masculinity, which has become the buzzword around engagements with men in the pursuit of gender equality. And then I will also share with you some emerging findings from our study, from some studies we've conducted at SRHR, to show how these positive masculinity programs are actually playing out in the field. And then I will end with a reflection of what I think the future of engaging men with some of these programs could look like for better impact. So this is what what masculinity is all about. These are social expectations of being a man, of being a boy. They comprise attitudes, behaviors that signify and validate maleness. It's also a way that some people want to be recognized by others. How do I, as a man, want to be seen out there? That is also part of what masculinity refers to. I will also be using the concept of masculinities in a slightly different way to refer to how men and women engage with the gender other relations in their own context. And this is why, in some instances, people will say that a particular man is not man enough. Or they will also say that that woman is actually a man. That's just a way of showing that people in society engage with gender other in particular ways in their context. There is evidence out there that masculinity operates in different ways and manifests in different forms in society. I have isolated there are many more ways than I have presented here. But the 5 key ways that masculinity operates include in terms of personal beliefs. And this is what we refer to as sometimes as being male in the head. People, go around with a consciousness. Men go around with a consciousness that they are men. They hold personal beliefs about what being a man means and how they should perform themselves as men. It also operates at the interpersonal level in terms of relationships that we have with people, the practices and behaviors that we invoke and we perform when we have those relationships with other people. That is at the interpersonal level. There is also the other level, which is the institutional level. And these are all very key in terms of understanding how masculinity, begins to affect women's economic empowerment and social and reproductive effect. At the institutional level, this plays out in terms of policies, institutional policies, practices, and cultures that might affect the kind of power that men maintain and show and put on display in those kind of contexts. And then very finally, at the ideological level, and this is where many of us pitch our work, at the level of social norms and the belief systems, within the societies that we operate that support particular gender orders and particular gender relationships. Now, when we speak about the intersections between masculinity and women's economic empowerment and social and reproductive health, there is evidence out there that this impact comes by way of six basic entry points. The first entry point there is about men's use of dominance and violence and control to assert their power and superiority. This has implications in terms of how men relate with women, the kinds of opportunities that allow them to have, the kinds of influence they will have in their lives, and so on and so forth. Another entry point is men's control of economic opportunities and resources at different levels, whether at the household level, at the level of political organizations, within organizational levels, and other. That's also another key entry point through which masculinity can actually affect women's economic empowerment and social and reproductive health. Another entry point is also men's control over women's social and reproductive health, decision making. In many instances, we hear about women not being able to seek, seek health services, make their own decisions when it comes to use of contraceptives and all that. That is one of the entry points through which masculinity shapes, affects, and impinges on women's economic and social and reproductive health. I think this point has also been made by the previous speakers. about men's lack of and limited participation in childcare, unpaid domestic work, and caregiving. That's also another very important entry point through which masculinity begins to can affect women's economic empowerment and social and reproductive health. But one of the least talked about entry point is also that some masculinity practices also affect men. They hurt men through causing them death, causing them poor health, keeping them in jail, and then making them to lose their earnings, and sometimes poor mental health on the part of men, which sometimes directly and indirectly also affects men and also affects women's social and reproductive health and economic empowerment. So these are just some of the ways in the literature that, through which masculinity as a practice, shapes women's economic empowerment and social and reproductive health. Now, in terms of existing work to engage men and to support them to adopt more gender equitable attitudes, this whole idea, this whole concept of positive masculinity has emerged, as a way of realizing that this whole idea of having more gender equitable men. And these programs are implemented in different contexts, in the context of family planning, in the context of maternal and social and reproductive health, in the context of household relations and all that. And you've got many of these programs being implemented by organizations at the community level, in some religious settings, and quite a number of them happening in different spaces. And what these programs tout, what they say they try to do, is that they want to transform men, create more equitable men by helping men to begin to challenge the gender orders, the gender norms, the masculine ideas that perpetuate inequality in society. Many of them also claim that they use evidence of what works to promote male engagement for gender equity and then for improved social and reproductive health. If you look at the literature quite very well, you also see many of them talking about how they try to nurture men's critical understanding of the links between masculinities and overall well-being. There are also, claims that they try to promote men's acceptance of responsibility for their own action, which is something that, quite a number of men out there are said not to ever do. And then the other way they try to do this is by, working with men to improve the understanding of the social and of the dynamic social and cultural factors that impinge on their lives and work as men. Because sometimes people might, keep operating in society without understanding some of the forces that push them to behave in particular ways that they do. So these are some of the key issues that some of these programs that work with men, that try to work with men to change them into becoming more gender equitable, I try to do out there. But one question that has never been answered in terms of these programs is whether they are really working in practice. Some studies we've done at SRHR show that, you can move to the next slide, show that there is actually very little evidence that these positive masculinity programs are working or are delivering the expected impact that people want to see. So this study was conducted in 3 African countries, in Congo, DRC, in Nigeria, and in Rwanda. And what I've just done is to give you a glimpse of some of the things that emerged from that study. These are men, so we compared 2 groups of men in this study. One group of men the first group of men were those who have participated in positive masculinity programs implemented by different organizations in these different countries. And another group of men who, say they have never been part of those programs in these countries. And when we asked them, to show their agreement with some of the statements out there and some of the practices out there in terms of that are quite very important in terms of understanding gender equality. In many instances, we find that there is actually very little difference in the views of these men based on their participation in these programs with regards to some of the statements. For instance, you ask them, when a woman says no to sex, do they really mean yes? you find that many men who have participated in these programs were actually more likely to say that, yes, when a woman says no to sex, she actually means yes. And those are some of the issues that I've just tried to highlight in the red with red, and I've tried to highlight in the document. What this shows us actually is that these programs might not be changing men's notions, men's attitudes, men's beliefs when it comes to gender in some of the contexts in which they are being implemented. So you can move on to the next slide, which is also a continuation of this. And this is the last slide I'm going to show with respect to this study. So when we specifically ask them about violence against women, you also see that in many instances, there is actually very little difference between the two groups of men in the 3 countries that we have that we studied. But one of the things that we also found quite very interesting is that when we ask them, have you ever tested for HIV? And do you know your HIV status? Most of the men who have participated in these programs, men who have not participated in these programs, we are more likely to know their HIV status. And we're also more likely to have been tested for HIV than men who have participated in the programs, which for us is quite very important in terms of the future of these programs moving forward. So what does that mean for us in terms of the implementation of positive masculinity interventions that seek to work with men to improve their gender attitudes? What this means for us is that some of these programs actually have very limited focus on the symptoms of inequality. They focus on issues of how men are socialized, and they engage these men with very uncritical concepts, very uncritical ideas about masculinity. Many of them are also not firmly grounded in our understanding of the structural and intersecting drivers of gender inequality. So they focus on this is how men are brought up in society, and this is why they have to change. They don't focus on the socioeconomic drivers playing out there in society that men need to be aware of in terms of helping them to transform into more gender equitable men. There is also evidence that some of these programs fail to foster critical self-reflection among men on the issue of gender norms. And then there was a study that I was part of, which also looked at the staffing of some of these programs. And we found that in many instances, some of these programs are actually not staffed with people who have strong capacity and necessary training to design gender transformative agendas that can work with men. Many of them are also often poorly funded. They run for a year or two, for 6 months, and there is very little funding to enable them, continue to do their work in the long term. And this is quite very dangerous because some of these programs are also competing with very dangerous narratives in the context in which they work. And it is very difficult to expect them to work, to deliver impact when they don't have the resources to be able to work a long time, to work for a very long time on some of the issues that they're dealing with. And one last point I want to make on this is that it is quite very difficult for men to unlearn some of the gender norms that we want them to unlearn in context of economic insecurity and other uncertainties. If you walk into a slum context in any part of the world, and you're going to tell men that they have to change, meanwhile, they are not even sure when their next food will come from, how they're going to feed their households. If that's how they define themselves, it's going to be very difficult to make them see why this is a priority compared to the whole question of livelihood. Now, my last slide on this, and this will be my final conclusion on this, is that there is need for us to begin to rethink some of the ways that we work with men. I have outlined some of the areas where that reconsideration, that rearticulation, that remotivation of some of these programs need to begin to happen. One of the things I think that we strongly need to do is to begin to review the language of work with men. Sometimes programs walk into a village, they walk into a city, and they begin to think about, they begin to talk to men about this whole idea of toxic masculinity. And we're telling men that the way their grandfathers have lived was toxic. We tell them that they're living caveman masculinity. And we take, traditional masculinity, things that men may not easily work with, things that men might not, begin to connect with very easily, or that might put them off on some of the messages that we want to pass on to them. And then the very final point here is that I have asked men in many places, what do you think will come out from this work around gender equality for you? And they asked me, well, the problem we have is I don't find that man that you want me to change to. I can't find him in my community. We can't find them in our politicians. We can't find them in our musicians. We can't find them in the role models we have in society. I can't find them in my religious leader. So where is that model of that man that you want me to change to? So there is need for us to begin to think about giving more visibility to real life models of transformed men that we want men to live up to. And on that note, I want to stop, hoping that I've inspired you enough now that my talk, will likely provoke more questions than the answers that you wanted me to give. Thank you very much.
Thank you very much, Doctor, for that insightful presentation. I think in the feminist space, the feminists online are both smiling as well as frowning. Positive masculinity, what I picked out is about dealing with issues of control, the power of dominance, and trying to demystify the social attributes and social norms that give men the ultimate power to violate women's rights and to continue to discriminate against women. And it's cutting across, and it's brought even into the workspaces and in society, including in service provisioning. I picked the fact that there is lack of evidence to justify masculinity or positive masculinity programs. You have highlighted the need to do more research, to also change strategies and probably rethink the whole approach in terms of who is it supposed to benefit. But also you talked about some challenges within the programming on male engagement and positive masculinity, which includes limited capacity and resourcing. But I think the feminists would think in the alternative and say, is it the right thing to do to engage men? And I think those are provocative questions that I'm throwing into the room for today's conversation. We are on schedule in terms of our program. And now I would like to invite to open this session into a brief plenary. But most importantly, I would like to share that Dr. Jemima has stepped out because she has another engagement, but she has other UN members, colleagues from UN Women who are in the webinar. And if there is any specific question that will be directed to what she presented and the programs, we will invite them to come and respond to us. So feel free. I have not seen any questions or comments in the chat, unless if my colleagues, Sarah and Crispin, if you can see in the Q&A, if there are any questions. But I would like to open the session now. If you feel you want to speak or comment on anything or ask a question, we have about 5 minutes to do so. Feel free and put up your hand. I think the hosts will be able to see you and allow you to speak. I open the mic now.
Can I make an intervention, Helen?
Yes, Kate.
Yeah, thank you. I did share quite a comprehensive set of legal frameworks and policies that, as we know, guarantee sexual reproductive health and rights and economic empowerment. And I do think it's also important to note that a lot of these provisions, if those policy processes were reopened, we would not possibly be able to get to the threshold that we do have now, because we've also seen an equal pushback on sexual reproductive health and rights and generally on women's human rights. So I think it's also a call to action for all of us who work on the realm of gender equality and advancement advancement of human rights and making sure that we live in equitable societies to, to be quite vigilant to make sure that we continuously, safeguard this rights that women and girls enjoy, but we probably haven't implemented the policies comprehensively. But we've also seen that these very rights are under attack. So it's quite important for us to continuously keep pushing for comprehensive intersectional frames that don't get us backtracking and keep safeguarding these rights that feminist activists have fought for so long. So I just wanted to make that pronouncement as an addition to my interventions earlier. Thank you.
Thank you, Catherine, for that. I can see Nicolene, you have your hand up. Please open your mic.
Yes, thank you, Helen. Thank you for this very insightful presentation. I want to come back to Mr. Chima's presentation on positive masculinity and whether it's working or not. Like, I share his opinion or his findings because this is something we have experienced, but not having the opportunity to conduct the survey like he did. We could not say it openly. But now my question is, positive masculinity is not working. What is the way forward? Do we need to ameliorate it? And what do we need to ameliorate it? Or do we need to completely abandon it? Because what he has said is in line with our own observations. I'm talking from Cameroon, Nicolene Waze from Cameroon, and what he says is just what maybe the data may have been conducted only in Rwanda and other countries, but even back here in Cameroon is the same thing. Men still occupy all the elective and appointed positions, and they still shape the lives of women using patriarchal and deep patriarchal connotations that we know how they impede the lives of women. So what is the way forward? Because I didn't hear him say what the way forward is. Thank you so very much.
Thank you, Nicolene. Any other comment? As other people are thinking, can I invite the previous speaker to come back and just interject on that question?
Yeah, thanks very much, Nicole, for that very interesting question. I want to say that, I come to things from a research perspective, and there is always doubt in my mind in terms of making very strong statements that do not have evidence to support them. What we have shown is that at least in the 3 countries where we've done this, there is very little evidence of the consistent positive impact of these programs. Does it mean that these programs are complete failures? I doubt that that is the point. Does it mean that we have robust evidence in terms of the evaluation of their impact in the field? I doubt that that's the point. I think they create some kind of basis, some kind of resource to build on in terms of getting men to begin to think more equitably in terms of gender empowerment and sexual and reproductive health. But I think a bigger need, there is a much bigger need than these programs are currently serving. In many instances, some of these programs are directed towards men who are poor, in slum settlements, in rural areas, and all that. These men are dealing with these households. Let me not just even talk about men. They are dealing with major socioeconomic issues of livelihood and all that. Trying to begin to change them without, a major focus on some of their basic livelihood struggles. For us, we think there is need to go beyond that. I think some of these I think the other thing in my suggestion about the way forward, actually the last slide I showed is about the way forward. How can we begin to reposition some of these programs to begin to have a bit more impact? And I think men just need to see I understand the feminist argument around, but men just need to see that model of a changed man that they can emulate. And I can tell you, I can't say it, I don't see it. Many men out there don't see it. So by the time we begin to create that model for men to emulate, maybe there'll be a reference point for them to begin to make the progress that we want to see them make.
Thank you, Dr. Chima, on that. Any other questions or comments? Yes, the presentations will be shared to the list after this session. And therefore, we ask you to please type in your email addresses so that you receive the presentations. There's a question. Yes, it's going to all of us, the speakers who have spoken. What is being done to address issues of integration, specifically looking at the milestones that have been made in the frameworks, using measures of integration into like healthcare, the workspace. I guess this also, I will also invite a colleague from the UN Women, Elizabeth, I've seen your name on the chat, to just speak to a little bit how the intersectionality this conversation has with the upcoming policy, the care policy, and probably how that will remedy some of the issues that we are dealing with here. So I'll start with you, Kate. How do we deal with ensuring that intersectionality continues to be addressed? And then I'll also invite, after Catherine, I'll invite Dr. Chima to also come back and speak to that intersectionality. In 2 minutes.
Yeah,
Catherine.
thank you so much. Thank you so much. There are attempts for, articulating where the intersections for SRHR economic empowerment look like, both in policy and programming and research, as well as we've all articulated, speaker after speaker after speaker. I think the challenge towards the end is the programming aspects of it, and this is also heavily driven by how programs are funded. So we know that the SRHR community is different from the economic empowerment community. Preparing for this webinar, wondered how I will marry the two, because I have never seen I have over time seen myself as an economic justice rights person, but I haven't in the past seen myself in that lens. And that's how programs are funded, that's how policies are conceptualized, but increasingly we have seen the attempt. For example, the ICPD program of action in 1994 did not have mention of economic empowerment, but we see that coming up 20 years later at the review with the Addis Ababa Declaration, Montevideo Consensus, etc. The Beijing Platform for Action had very separate critical areas of concern for economic empowerment and women's health. But with the GEF thematic areas, we did see much more integration of those two concepts and other concepts, reducing the 12 to 6. So increasingly, there has been a push for that, and especially younger feminists have constantly reminded us that women and girls don't live single issue lives. It's the same woman who needs access to a SRHR, who needs access to a job, who will be needing access to education. And so being mindful to program around the person and be much more person-centered as opposed to issue-centered is critical and important. And I think also we've seen that in terms of sometimes consensus building for these issues, we need to also do better in terms of being understanding what the issues look like, but also being progressive in terms of policies and conceptualization of these concepts, right? So we know that discussing SRHR means discussing topics like access to safe abortion, not just health services or family planning or contraception. It means being much more bold to thinking of women not just in binary terms, of women and girls, but we also have women and girls who don't identify in binary terms. So I think pushing ourselves beyond the realms of what's comfortable to us is another call for us to be much more truly intersectional and truly for us to get out of what are our conscious biases. So policies have attempted to do that. I think some of the language that has been used, I had Dr. Jemima refer to it, intersecting multiple intersecting forms of discrimination, which means that one person who could be who could have a disability, who lives in an urban settlement that's from a poor background, who's much younger, who identifies as a lesbian or bisexual or queer woman, or who's an indigenous person. That particular person could go to look for a job, and what does that mean for her in terms of, or them in terms of being employed. So just to expand the discourse and to say that it's been a journey towards a journey of 1,000 miles, but starting with a few steps. And I think we've made quite a couple of strides, and it will be great to continue building on that. Thank you.
Thank you, Catherine. And I'll give 2 minutes to our colleague from UN Women. Elizabeth, are you online? We'll check whether she's still online. Colleagues, please check if Elizabeth is online. And as we invite Elizabeth, I think allow me to also move us to our next agenda item. We are at a point where now we need to get into engaging everyone who is online. So we are going to get into our breakout sessions. So please, just to check whether we have Ms. Eva Muluve, the research fellow at the Population Council of Kenya. Are you online?
Yes, Helen, I'm here.
And then also our moderator for group 2 will be Dr. Anthony Ajayi, Associate Research Scientist at the APHRC. Are you online?
Yes, I'm online. Thank you.
Great. Good to have you, and welcome. We will not spend much time here, so I'll invite the colleagues. Just one last check. Elizabeth, are you online? Would you like to intervene on the intersectionality before? But meanwhile, we will be going into our group sessions. So group 1 will be moderated by Ms. Eva, and you're going to unpack 2 questions. One of them is unpacking the pathways and intersections of SRHR and women economic empowerment. And also you look at evidence in terms of gaps for intersecting economic and SRHR issues. That's group 1. So those who are interested in joining that group, please look out for the link and just click on it and join the link. I think will be popping up in a short while. Group 2, that will be moderated by Dr. Anthony. You'll look at the current opportunities for addressing intersections between economic and SRHR challenges in Kenya. What are the opportunities for addressing those challenges in Kenya? And how can SRHR organizations and women's economic empowerment organizations collaborate and support each other? So this is more around partnerships and strengthening collective voice. So if you're interested in that conversation, please, you'll join the link for group number 2. So our hosts, I hope you're ready. And while you're in the groups, you will have 30 minutes to have a deep conversation, be engaging as much as possible. Please identify a rapporteur who will take your notes, and the facilitators, the moderators will lead the conversation. And when time is up, you will be brought back into the main plenary, and we'll have feedback from each group in terms of highlights of the discussions that happened from there. So with that, I hand over to our hosts to take us to those groups.
Thank you so much, Helen. We are broadcasting the groups now. And in the interest of time, we could shorten our to maybe 20 minutes tops. That would help us to be back in good time.
Okay, but also while in your group, also continue to introduce yourselves. There will be a chat box. I think that will be active in the different group sessions. So just introduce yourselves in that chat box so that you can see who is in the. Okay. Crispin?
Yeah, I see room 1, only 2 people have joined. Can we try to join in? None is in, yeah, I see one in group 2. If we all there, we can do it quickly, just a few seconds, and we will be done. Could you check?
I can't see an option of how to join the breakout groups.
Okay,
Yes,
just a
I'm
minute, we're
getting
figuring out
an
what
image.
might be up.
Okay, okay. So the pop-up is for group 1 or all? Crispin, are you still here? People are asking how to join group 2. Sarah? Sarah? And Crispin, people are asking, is there group 2? Hi, Samuel. I think we have, you can alert the groups. We have 2 minutes to go.
Should I leave this conversation? Should I leave this meeting? Hello, anyone is here?
Yes, we are here. Most of the participants are in the breakaway rooms, but they will be back in a few minutes. So just stay. We have like,
Right?
okay, just stay here.
Yeah, okay.
Helen, we are back. Please proceed.
Thank you. Thanks to our moderators. Welcome back, everyone. I hope you had very fruitful conversations, and I hope they were quite engaging. In a few minutes, I think I'll give 5 minutes to each group, and I invite the group leads to take us through what came out from there. I'll start with Dr. Anthony. Anthony, are you ready?
Yes, I'm ready. So our group 2, we were asked to discuss 2 questions. One is current opportunities for addressing intersecting economic and SRHR challenges in Kenya. I think the first opportunity we think is important is political participation, women's political participation, because it is through politics that shape our well-being. So it's important that we have representations of women when decisions are being made, especially on SRHR issues and women's or empowerment issues in general. And there are always opportunities, especially even with the members of parliament. There are women currently, or even there are cabinet secretaries and all that. How do we work with them to ensure that they are well aware of all these intersecting issues and be able to raise these issues, to be involved in these decisions and ensure that rights of women are not maligned. As you know, in the current space, there are issues regarding oppositions to women's economic empowerment and SRHR. But then when these decisions are to be made, are women represented? And the women that are represented, are they well aware of all these issues? And so it's important that we recognize the importance of politics in tackling these problems. And of course, also the need to make policies gender responsive. So it's also tied to the second suggestions on capacity building as important. How are we supporting women to tell their stories? How are we creating spaces for marginalized groups? And so issues of capacity building is considered as an opportunity to address some of the issues. But more importantly, there's also a need to build solidarity between advocates of economic empowerment and SRHR to find areas of convergence. More importantly, the idea of harnessing positive masculinity as well was also raised. That's also very important. But more importantly, we believe that some of these concepts also people need to understand what they mean, as very few people understand them. How do we explain the linkages between SRHR and women's economic empowerment to layman, to people on the street, so that there is more understanding of these concepts. And there is an intervention on the need to find balance when we address these issues to ensure that we also do not emasculate men. So finding that comfortable balance between these issues are considered to be important. On question two talks about how can SRHR organizations and women's economic empowerment organizations collaborate and support each other's goal. The first point made here is the need to create spaces for discussion and sharing of ideas. The need to identify synergies, commonalities. The need to understand what these organizations are doing and how to key in to support one another. But more also the need to have more platforms for knowledge and resource sharing was also raised. And then lastly, there's also the need for education and advocacy on the need to partner and work together. So these are the few suggestions made, and without further ado, I would like to hand over to the moderator. Thank you.
Thank you, Dr. Anthony, for that. And that was quite elaborate and very clear. Opportunities identified as well as the new strategies and the way forward. On that note, allow me to invite the next group, representative for Group 1, and that's Ms. Eva.
Thank you. Thank you, Helen. So I think in Group 1, we were tackling the question around unpacking the pathways and intersections of SRHR and WEE. And our second question was also around looking at the evidence gaps for intersecting economic and SRHR issues. So in terms of like some of the pathways, what came out was there's need for evidence to be able to drive action at the intersection of WEE and SRHR. So the call for more robust evidence to be able to help us understand what these intersections really are. There was also a mention around building capacity and mentorship, especially for gender diverse people to be advocates or to be researchers, for example, in this area. And this was because there's the belief that if they gain this kind of skills, then they would not only be able to, for example, advocate for more work or more uptake of this area, but also through the skills they gain through empowerment and capacity building, it offers them opportunity for employment. So opens up like those economic opportunities for them into paid work, especially. There's also something around like discussions around comprehensive sexuality education, just to enable women to have for example, promote bodily autonomy, to be able to have more skills around, knowledge and skills around SRHR. And through these, then there will be a demand, they will be able to have the ability to demand quality services, SRHR services, and also help in empowering them and offering opportunities and linkages as well to the economic empowerment. There was also the mention around male involvement in programming, especially around the areas of intersections of SRHR and WEE, and questions around like how do we ensure that we are engaging men without really taking away women's agency and through their involvement, but also acknowledging that it's important to involve men, especially if we want to alleviate harmful traditional practices that lead to negative sexual reproductive health outcomes for women. There was also the mention around trans and intersex people and how we can better ensure that they have access to sexual and reproductive health and rights. We also had the conversations around how do we ensure that in terms of advocacy and in terms of like advocacy around SRHR and WEE, we ensure that we are localizing our programs, we are localizing our strategies so that we are starting at the household level, because a lot of the advocacy is aimed at community levels, but we seem to forget, for example, to build capacity for the very members that are closest to us. So localizing WEE and SRHR interventions and also bringing them closer to the home. For the second question around the evidence gaps, there was mention around limited evidence around understanding these intersectionalities. So we have bits and pieces of evidence here and there, but there is still a need to generate more evidence to ensure that we are truly tethering out some of these intersectionalities and what their impacts are, especially for women and girls. There was also issues around more evidence that is needed on how to strengthen these intersectionalities. So yes, there are programs that have been successful, but either they are not documented or it's not very clear around what really works to strengthen these intersectionalities and what the impacts at the end of the day are when it comes to especially how they impact positively eventually on economic empowerment or sexual reproductive health outcomes for women. There's also the gaps around measurement tools, which has come up. So need, for example, to look at how we can strengthen measurement tools that are used to measure women economic empowerment. So there are limited measures, maybe around 3 or 4 that are consistently used especially in the African or low resource settings or in low resource setting context. So I think a call, for example, to try and see whether there can be more to do with developing measures that are very responsive and are able to articulately measure WEE, especially in our context. And then there is also issues around, for example, some of the findings that we see are not very straightforward. So for example, when you look at some studies, they talk about women economic empowerment also being a contributor to gender-based violence, and therefore further research is needed to understand these kinds of linkages, because on the one hand, we have studies that are showing that without empowerment, definitely women are vulnerable to such issues such as GBV, but in some contexts, the empowerment itself could also be a contributor to GBV. So more research required in terms of trying to understand some of these negative unintended consequences of empowerment as well. We also have few studies that have been documented on interventions, as we mentioned, and also there was the feeling that there is need to contextualize some of these research so that they are reflective of our low resource settings, because we know that a lot of them are actually based in some of the high income regions, and therefore a call for more context-specific research and evidence generation to understand the correlations between WEE and SRHR. So that was it from our group. Thank you very much. Handing back over to you, Helen.
Thank you very much, Eva, and thanks everyone for participating actively. We have deliberated on the topic, and you'll agree with me that it wasn't an easy one to unpack. Issues of intersectionality definitely are complex, specifically when it comes to women's issues. I think allow me at this point to just summarize what is coming out from today's conversation into a few points before we close. What has come out is that intersectionality is a rights issue, and when you talk about women's rights, you cannot address one right and leave out another. Because women's rights are indivisible, you cannot address them in silos. So when you're dealing with sexual reproductive health rights, you're likely to meet violations in form of gender-based violence. When you address women economic empowerment without empowering women holistically and involving other stakeholders like men, you're likely to also escalate GBV. So interlinkages are it's also what came out very strongly is that we need to intervene or to think about interventions that enable women to become more empowered in a holistic way so that they can claim their power, they can use it in form of making decisions, they can exercise their rights to choose, especially in relation to SRHR. But at the same time, they can also make decisions around economic resources. And also we need empowerment that brings on board men to support women, especially in the reduction of unpaid care work and other burdens that women struggle with. What also came out strongly in terms of intersectionality is the relationship between education, capacity building, and even financial inclusion and empowerment with SRHR. It was very clear that when women are not empowered to make decisions, some of the unlikely negative consequences linked to their inability to participate in the economic space equally, but also they can't access education. And if they don't do so, they are likely not to make the right decisions. So aspects of social protection came out very strongly. You'll notice that there are issues around access to health services, the quality of services, accessibility, and affordability. So this is where also you can't avoid talking about health insurance, universal health coverage, and all those aspects
and how this indirectly or directly impact women's economic empowerment as well as SRHR. And of course, some of the things that are coming out clearly provide a justification as to why ICRW is, for example, is a convener of different thematic working groups on women economic empowerment. These are communities of practice that are discussing these issues. They may seem to be discussing them in silos, but what is coming out today is that there are definitely interlinkages between SRHR and GBV, SRHR and economic empowerment, financing, inclusion, and sustainable entrepreneurship initiatives that come out. Issues of unpaid care work and domestic work needs to be addressed at policy framework level. Resourcing and key decisions have to be made also at household level by involving men. Education and capacity building is another thematic working group, and we've heard that the role that they play as a community of practice will also enable us to generate evidence in terms of what is needed to address these issues in an intersectional manner. Of course, in the presentations, I think Kate mentioned all other rights like land rights and property rights that may not necessarily come out, but when you talk about women economic empowerment, you're likely to find instances of violations of women's land rights and property rights. So these are things that really provide that justification, and therefore it's important that these communities of practice are supported to continue to engage, and we hope to continue to learn together in these kind of conversations. Of course, we've identified gaps from the group discussions, and I will not repeat them in the interest of time. If you'll allow me, I will therefore just acknowledge all the members of the different communities of practice that are coordinated by ICRW, and all the contributions that you're making into these conversations around women economic empowerment, but also to really acknowledge our support and the support of the donors, the Bill and Gates Foundation, especially that provide the resources that enable ICRW and all the members of the different groups to continue to engage. We hope that we continue to learn, and peer learning is very critical, and hopefully we will continue to generate evidence that will enable policy making from an informed point of decision making, but also with evidence that will advance further research into areas that do not have enough evidence. And with that, we therefore acknowledge all the members, and we thank ICRW team for hosting us, and we give you a round of applause. In the reaction box, please give a round of applause for our team that organized and hosted us. We have a reaction box. Please just do that, and we thank all of you. We thank our speakers who have been with us. They led us through the conversation. It was rich, and we commend them for giving us their time and for the technical knowledge that they have contributed. And with that, just to announce also that the thematic working group on SRHR and GBV will soon commence to have their thematic meetings, and our convener, Sarah and team, will be reaching out to us. So look out for those conversations. We wish you all the best in your different communities of practice, and we hope that we can continue to engage effectively. Aluta continua, and all the best. Thank you, everyone. I wish you all good evenings if you're in East Africa, and good mornings if you're in another region, and good night if you're headed to sleep because of the time zone. But together, we will achieve our aspirations. Thanks, everyone, and we declare this webinar closed. Thanks, everyone.
Thank you.
Thank you very much. Should we leave it now?
Yes, feel free to leave if If you have any chats, anything you want to ask, you may still drop on the chat, but feel free to leave now.